CC-486 was presented as a late-breaking abstract at ASH last year in this trial, which randomised 472 patients in first remission after intensive plus or minus consolidation therapy for patients aged 55 years or older who were considered ineligible for an allogeneic stem cell transplant. At this year's ASH, we present a new analysis which looks at the outcomes of patients that received either 0, 1, or 2 or more consolidation cycles. Interestingly, the patients in the CC-486 arm had an improved relapse-free and overall survival in terms of substantial trends for overall survival, regardless of the number of consolidation cycles received. So whether patients received 0, 1, or 2 or more consolidation cycles, if the patients received CC-486 versus placebo, they had better relapse-free as well as trends for overall survival. None of these analyses were adequately powered in their own right for significant differences, however. One of the interesting aspects of this trial was that if patients received CC-486, compared to the placebo arm, they seemed to have better outcomes in terms of relapse-free and overall survival, regardless of whether the placebo arm patients have received 0, 1 or more consolidations. And it raises the interesting possibility or question as to whether how many cycles of consolidation do patients need to receive before going on to maintenance therapy. And at this stage, it would appear as if patients have a very good outcome with CC-486, even if they have no consolidation therapy after achieving first remission. So obviously these are interesting post hoc analyses, but certainly raise intriguing questions about when to start maintenance therapy, and also the potential to how do we further improve outcomes in maintenance therapy by either using CC-486 in combination with other agents perhaps in the future.